Hello, Namaste. My name is Dr. Priyanka Saokar. I am owner of World Class Dental Clinic, which is located on FC Road, Pune. So today I am making this video specially for my patients, because last time when we have discussed about RCT, how to do RCT, in which cases it is recommended, and what are the proceeding after RCTs. So many patients ask me which type of crown they should prefer after the RCT treatment. So it is totally your choice what type of crowns you want, as well as your dentist will guide which is better suited for you. Suppose the RCT is done with the front teeth, where they have it is because of the trauma, or the either the tooth was discolored or there was some abscess. So that time, most of the time, we dentists suggest our patient to go for zirconia crowns. Why zirconia crowns? Because again the translucency is best with zirconia crowns. Then the second type of crown which is most commonly used is ceramic crowns. So in which cases we recommend it? Zirconia crowns and ceramic crowns, there is some difference of cost also, because ceramic crowns are much cheaper when we compare to zirconia. So few cases, if they have some economical issues, or it's not feasible for them to go for zirconia crowns, that time we advise them you can go for either PFM crowns, that is the ceramic crowns. Those are also best suited for them. And mostly when we advise them ceramic crowns, PFM crowns, that time mostly it is in the posterior area. Again, there are some cases where we advise metal crowns too, mostly in cases where we have done wisdom tooth RCTs, and as the wisdom tooth is a last erupted tooth, that time we don't get the some amount of occlusal clearance is needed to place the crown. Since metal crown needs minimum amount of occlusal clearance, in such cases we advise them to go for metal crowns. Even in kids, most of the time we advise metal crowns, because they have deciduous teeth, and anyways those teeth are going to fall. So aesthetic concern or aesthetic requirement is very less in kids, plus anyways deciduous teeth are going to fall, so we advise them to go for a metal crown. So these are basic things. Whenever the aesthetic demand is very high, we advise zirconia crowns. Whenever the economical constraint is there, and patient has to choose between some cheaper option as well as tooth colored material, we advise them PFM crowns. And third, when there is very slight amount of occlusal clearance, and anyways that tooth has bad prognosis, or anyways after some years we need to extract the teeth, or in case of kids deciduous teeth, that time we advise them metal crowns. So this is all. Hope this video will help you to take your decision, and anyways I am going to make a detailed video regarding zirconia crowns as well. So keep watching, do like my channel, subscribe it. Bye bye, take care.